welcome to you from Geneva, Switzerland. I'm Reda Sadki. I'm here with Charlotte and Boo. We're part of the Teach to Reach 10 team, but I would like to say actually Teach to Reach 10 family. And with us are leaders of the Teach to Reach community. In 2 minutes and 57 seconds, you'll be hearing their voices, and you'll be hearing the voice of our guest, Renzo Guinto. He's I don't know whether to call him a leader, a specialist, a researcher. I think he's all those things on what many people now are calling planetary health. And so we'll be in just 2 minutes, 30 seconds, we'll be kicking off and getting to know him better and welcoming him to the Teach to Reach family. See you in 2 minutes. If you're listening to the podcast, you can skip ahead 2 minutes and 20 seconds at this point. Our audio-only podcast is specifically for people with connectivity issues. It's a great way to save on bundles, save on connectivity, and download the audio so you can listen to this lightning chat without spending the time and the expense on YouTube. We have many other lightning chats coming up. We've already completed our first one with Toko Elfikpuli on climate change and neglected tropical diseases. That was on Tuesday, but you can now watch it on our YouTube channel. This afternoon, we'll be welcoming Revati Falki. So she is responsible actually for child health and nutrition at Save the Children International. Maria Nera from the World Health Organization will be joining us as Kate O'Brien to explore the connection between climate change and immunization. Our Teach to Reach partner, David Akpan from eHealth Africa and EHA Clinics will also be joining us. And then our own climate and health fellow, Luchuo Ibain, will be coming in on climate change and decolonization of global health. So that's coming up in the next few days as we're counting down. And Charlotte, let me check with you. How many days until Teach to Reach now?
But actually, I think we are we are just about 12 days from Teach to Reach 10.
Indeed.
30.
Yeah, all right, we're counting down. Yes, you're absolutely right. 12. So you can check. For those of you who are wondering about, who've just heard about Teach to Reach, you just find the Teach to Reach webpage. You'll see there's not only the number of hours, but this is where you can request your invitation. All you have to do is type in your name and email. You will receive lots of emails, but each of them have a specific purpose. So I encourage you to look at that. And I believe we have to get going. Right. All right, a warm welcome from Geneva, Switzerland. I'm Reda Sadki, and I am here with Charlotte and Booth. Will be your co-hosts today. Those of you who know Maria Monzan, she is sleeping in Corrientes, Argentina, or at least we hope that is the case. And of course, we're here to meet our guest for this lightning chat, Renzo Guinto, where he's going to tell us about, and we're going to ask him questions about planetary health. If you're watching on YouTube, Facebook, wherever you may be, do introduce yourselves. Tell us who you are and what you are doing here. Before we dive in, I'm going to tell you a little bit about why and how at the Geneva Learning Foundation we came to this question of climate and health. So last July, we asked this global network that we support, nurture, listen to, learn from, of how over 60,000 health professionals throughout the world in over 137 countries, and 4,700 people in less than 2 weeks registered for what we call a special event. We asked this question: is climate change a threat to the health of those you serve? And if so, why? And had, in the first 2 weeks, 1,234 people respond. Most of you who responded, who are health professionals, said that you are part of the family or a trusted friend. And then we asked you, climate change is a threat to the health of a community that you serve. And most of you gave it a high or very high threat level rating. And you can see that the big red bar, the scary part is many of you do consider it is an imminent threat. And then we also asked you, is as a health professional, you worry about climate change? And that is, and again, you told us that you have the highest level of worry on these questions. So we're going to dive right in with our guest, and Charlotte is going to kick off with the first question.
Thank you very much, Reda, and it's a pleasure to have you with us today, Renzo. As a pioneer in the field of planetary health, how will you explain the concepts to a health worker who is new to this idea? What are the key principles and why is this approach important?
Wow, thank you very much for that question, and thank you very much for having me in this wonderful convening. I can feel so much the energy, even if we're just in Zoom. I imagine if this is an in-person event, wow, this energy is certainly very much infectious, but very much needed as we try to confront and address many of the pressing challenges that we're facing today. The question, what is planetary health and how can we explain it to fellow health professionals, especially to frontline health workers, but also to any person, your family members, your grandma and your grandkid, because I think we need to really communicate planetary health to as many people as possible. When we say planetary health, and this is how I always tell about planetary health to my future doctors here in Southeast Asia, in the Philippines, and now I'm here based in Singapore, I always remind them that in this day and age, we now have not just one kind of patient, but two kinds of patient. On one hand, you have, the kid, the person, the human being who is affected by many of these, pressing health challenges like air pollution or, food that is unsustainably produced or climate change. And on the other hand, you also have Mother Earth, who is also, sick and being inflicted with disease and different kinds of harms and damages. And we need to also take care of Mother Earth because, our health greatly depends on the health of the planet. The health of people in the planet are deeply interconnected, deeply intertwined, and in fact they're inseparable. And so we cannot anymore approach the problems that we're facing today in a siloed manner. We need an integrated and holistic approach, and that is really what planetary health is all about. And so, you also ask, what are the key principles of planetary health? And I think I alluded to some of them already in my description of planetary health. We need to think of systems, not silos. We need to look at root causes, not just the symptoms. And in the healthcare profession, we always say we want to make sure that we are addressing the root cause of disease and not just alleviating the symptoms. It's the same philosophy that we should apply when we're trying to address problems such as climate change. We also care about equity and justice. We want a healthy and livable planet that everybody on planet Earth can enjoy, not just for some people, but for all people, especially the poor, the marginalized, the underserved. And what's amazing about planetary health? We're not just thinking about the health of people living today. We're thinking about the health of people who will live 100 years from now. And this is, the principle of intergenerational equity. We cannot be selfish people and selfish ancestors thinking only about ourselves and forgetting about the health of our children and our grandchildren and of the children of the world who will be living 100 years from now. And that is really the beauty of planetary health. We're thinking long term. We're thinking about the future. We're not just thinking about ourselves. We're thinking about every human being living today and in the years and centuries to come.
That's quite.
I hope that was sufficient.
Yes, Renzo, that's quite a kickoff, and we can feel the passion. You would definitely fit right in at as part of the Teach to Reach. So when you are in front of a global leader, someone who, like it or not, is part of this relatively small set of people who make the decisions, control access to resources, whether it's a big global donor, a government. What do you tell them about the concept of planetary health? And of the two, the health worker in the community and the global leader, who has the hardest time understanding why this idea matters for the future of our societies?
You know what? I think we can also still convey the same message that I gave to you a while ago, even to our leaders, our decision makers, our politicians, who doesn't, appreciate, the interconnection between our health and that of the planet, And by the way, I forgot to mention a while ago, because initially the question says or alludes to the idea that planetary health is a new concept. It's not a new concept. This idea that the health of people and the health of the planet are inextricably intertwined, this idea has been existing for centuries, if not millennia. We just need to go back to our ancient, wisdom, indigenous cultures. The indigenous peoples of the world have already been embracing this holistic and integrated idea for centuries, for many, many years. And so this is really just reviving what we already knew, what the planet Earth, what communities for hundreds of years have been saying, that our health cannot be separated from the health of the planet. It's the same message that we can give to politicians. And, going back to your second question, what my experience is that communities do understand it better and much more easily, because we are already experiencing the impacts, let's say, of climate change and many other environmental threats on our health, on our children's health, on our families' health. This is something so raw, so visceral, so personal. And so it's so easy to understand the idea. And I hope that our politicians and our leaders will also, resonate and will listen much more clearly and more openly. And I think this is what this is what difference or different approach is needed for politicians and policymakers. Apart from the story that I said a while ago, we need to put a human face to these problems. And so it's important to share the stories of patients and communities to politicians. I remember there was a time when I brought not only doctors in white coats, but also patients to the Senate of the Philippines, just to make the senators understand that climate change is not just an environmental issue. Climate change is not just about polar bears getting dehydrated, although we want our polar bears to be white and fluffy. Climate change is fundamentally about people's health. And it's important that our leaders see the effects on people's and communities firsthand. And also, I think this is where the importance of science and evidence is also critical, cannot be understated. So the combination of, the story, the statistics, and the positive example that we have as a health sector, all these are important ingredients in order for us to communicate the planetary health message to our leaders, policymakers, and decision makers.
Great, thank you, Renzo. We have a first question or comment from Ebenezer Owine Abangba. We ask with Charlotte that before you raise your hand, if you can type your comment or question or summary of it into the chat if you're with us in our Zoom studio. If you're online on Facebook, YouTube, wherever you may be, just go ahead and type it. Don't just introduce yourself. Ebenezer, we're asking you to, to speak. And we'd love to hear from you. Do introduce yourself first. Tell us who you are, where you work, and then what is your comment or question for Renzo Guinto. But keep the intro short.
All right. Good morning, good afternoon to everyone. I'm Mr. Ebenezer Awune Amongba from the Upper East region. I'm the founder and CEO of the Akanyue Foundation. I work with Enterprise Life Ghana. I consult for the 22 insurance companies in Ghana. I worked with the community planning committee in the Kasana Municipal. I am a man of God, and these are the fields I does. Now, the question I have for Renzo is about the climate change that he mentioned. I really appreciate his presentation. But in the Upper East region of Ghana, Akanyue Foundation is currently embarking on a project that is on climate change that is affecting the marginalized groups, the poor and the needy. Now, here is the case that if an organization is self-empowered to carry out this project in its own capacity, how will that organization get support or get resources to continue with this particular project? For example, my organization has mobilized funds on their own to work on climate change, which is affecting the health of people in 5 sub-districts in the Kasana municipal. So in this case, on our own limited resources, how can we be helped with resources to continue to help? Number 2, in many cases, we go to meet most of the poor and they actually need support where our funding is limited. How can we get support to continue with the education of climate change that is affecting health and also giving an impact to those that are actually marginalized or the poor that deserves? Thank you.
Thanks, Ebenezer.
Thank you so much.
So resources and support to the poor. Obviously, as a CEO of a local organization, Ebenezer is, it is part of his job, I imagine, to look for resources. Renzo, you're not a donor. What would you like to say in response to those 2 questions? And then I think that support to the reality of poverty at the intersection of climate and health.
Right. Well, I'm not a donor, but we, advocates, champions, implementers, those of us who really see the problems on the ground do have the power to influence, funding priorities, funder decision making. And this is why we really need to, make sure we have the evidence, we have the stories, we have the examples, the proofs of concept, that, we have done this, we've been doing this, we want to expand, we want to scale up. And that is how we can convince the donors to put more dollars to these kinds of initiatives. So that's one, we really need to be keeping on advocating and championing and knocking on the door and even knocking on the window if we really want to make sure that we have more resources for our work on climate and health. Having said that, I think we also have opportunities to explore how we can incorporate climate change into our existing, funding streams and projects. For example, if you're working on tuberculosis, start thinking how to make tuberculosis programming in your locale, in your countries, more climate resilient, more climate considerate. Same thing for HIV/AIDS, same thing for, let's say, vaccine preventable diseases. So we have to, I guess it's an invitation to being more creative and being more, forward looking in terms of applying a climate lens into our existing projects while we're still looking for more money to address some of the emerging, climate and health challenges that we're facing, which may not be covered yet by traditional, global health funding. And also, of course, we need to influence government funding for, climate resilience building and health system strengthening. For example, in my home country, the Philippines, what we're seeing is that there's money for climate, there's money for health, but they are not talking to one another. And so the challenge is how to find ways to increase the synergy between our health financing and our climate financing, because one, many of the solutions are at the nexus, at the intersection. And number 2, if we invest in climate adaptation, we will improve people's health. And if we strengthen the health system and address the diseases, we will also protect people from climate change. So I hope this is sufficient, advice on how to navigate these new complex spaces.
Thank you, Renzo. We are halfway through this lightning chat. Back to Charlotte for a story and a question. The story is from Justine Muga Bekazi.
Thanks, Reda. Muga Bekazi Justine, a midwife from Uganda, shared, the health infrastructure has been destroyed or affected by floods. Water reservoir tanks burst due to extreme heat experienced during the prolonged dry seasons. Mothers who come to deliver at health facilities lack water to wash after delivery, and even the midwives fail to get water to use for cleaning and or scrubbing blood off the floor and delivery beds after delivering the mothers. In the communities, wells are dried up and lack of water to bathe and wash has led to increased cases of diseases such as scabies. Renzo, as a planetary health pioneer, what emotions does a frontline account like Justine's evoke for you? It feels overwhelming. How can we possibly respond to thousands of vivid stories from health workers grappling with heartbreak and overwhelmed as they witness the impacts of climate change on their community's health?
Wow. Can I answer now? Thank you very much for that testimony, but also for really expressing what many of us in the health sector do experience and feel when it comes to the additional burden of climate change that is being added to the existing health problems, the health situation that we are now facing. Even without climate change, we have lots of public health problems, and climate change is now exacerbating, worsening all these, long-standing or chronic problems that we're facing. And I also feel, sadness and frustration because what is happening is unjust. It's communities who did little to even nothing, nothing to, benefit from, the crisis that is already unfolding in front of very eyes. They have nothing to do with it. They did not emit the greenhouse gases into the atmosphere. They are, still quote unquote developing countries, right? Because it's the developed countries that really, put carbon into the sky and now with destabilize the climate system, and it's us who are bearing the burden, the disproportionate burden. So it's really injustice what we're facing now, what we're seeing now, and then now we're being asked to adapt, to cope, to become resilient. Resilience has become a buzzword. Everybody now has to be resilient, even to problems that we did not create for ourselves in the first place. So it's injustice that I'm feeling now. And I think we really need to speak more and more, as health professionals about the injustice of climate change and the way it is widening further the health inequalities that we already are facing. And we need to, urge, the big countries, the rich countries, to put their money where their mouth is. If they want, they really want to help us, they have to put the money in adaptation, in resilience building, in the local frontline health workers. They also need to make sure that we accelerate the transition to a green economy, because that ultimately is prevention. It's planetary health prevention. We cannot just be, stopping fires and flooding and all these effects without addressing the root cause. Again, I mentioned a while ago, that is one of the key principles of planetary health. So again, thank you very much. It's very humbling to hear your story, and I hope that our stories, can really, amplify the message and touch not only the minds, but the hearts of decision makers and the big countries and the powerful people to make the necessary decisions for, our planetary survival.
Thank you very much indeed. Renzo Guinto, ahead of Teach to Reach 10. Health workers are going to be sharing experience on the front lines of climate change and health. If you haven't registered yet, well, let me tell you what is happening with this event. When we started Teach to Reach 6, there were 12,398 participants, split between Anglophones and Francophones. Teach to Reach 7, we were over 13,000. Teach to Reach 8, largely driven by the Movement for Immunization agenda. We were over 16,000. Teach to Reach 9, last October 2023, 17,662 health workers participating. And the amazing figure for this, and this was actually 2 days ago, so it's likely to have significantly gone up, is that there are 21,050 health professionals at least, and likely to be much more, who've registered for Teach to Reach and who are responding to the call that we originally launched in July 2023, calling on health workers to begin that process of sharing experience, of learning from each other, and also providing an opportunity for people working wherever they may be, in whatever capacity, to get insights from health workers on the front line of climate change and health. So if you have not seen these events, these documents, you can access them now. And I would say the most important thing is to make sure that you are there on the 20th and 21st of June for Teach to Reach 10. This will be the 10th time that we're holding Teach to Reach. You can see some of the outputs from this amazing community on your screen. Now, back to Renzo, and you've hinted at this, and it's actually a critical question. So it's a question of causality. So, for example, Faithful Chibanda Mulangu from the DRC shared with health workers last July. She said the community is facing a surge in cases of malnutrition, highlighting the urgency to address the challenges posed by climate change on both agricultural practice and food security. So the question for you, Renzo, is how, she's a community health worker, how can she know that there is a causal link between climate change and the malnutrition she's seeing? What guidance can you offer to health workers who are trying to understand, to investigate and substantiate that connection? They can see it, they observe it firsthand, but in global health, individual case studies, lived experience are often dismissed as a bunch of anecdotes. So from your perspective, one, what's your advice to a health worker, very concisely, to tell us what can he or she do? And second, what is for you the value of these stories and experiences? How do they fit into the bigger picture?
Well, thank you again for the question. Our nutrition, the state of our nutrition is very much interlinked with, the health of our food systems, which is in turn linked to the health of our environment, our climate system. Our food system heavily relies on the environment so that we can put food on our tables. And so if we really want to address, nutrition and nutritional problems aggravated by climate change, we need to go beyond, addressing micronutrient deficiencies and start working with the food and the agricultural sector. We need to make sure that our farmlands and our fisheries are resilient to the impacts of climate change. We also need to make sure that we are producing the food that we consume in a sustainable way that does not harm, the planet. And, in terms of the types of evidence that we need, of course, there's value and power in numbers. But now what we're realizing is that our stories, and I think I've already reinforced this a few times already during this conversation, our stories, especially if they are, combined or gathered in numbers, because many people are now experiencing these problems, also does have their innate, power. And I hope that we will engage more, our social scientists, our anthropologists, our psychologists, in really trying to capture the lived experience of people and communities, in the climate front lines, and use that and present that in a way that policymakers can understand, that decision makers can act on, and also that can inspire, the public, inspire entrepreneurs, inspire health professionals to act. So don't underestimate the power of stories, because these stories, they come from us, and they carry, not only, the comprehensiveness of the human experience, they also bring authenticity. And no one can dispute the stories and the experience that we bring to the table.
All right. Thank you, Renzo Guinto. Now, Charlotte has what will be our last question. The next to last question is on that causal link. If a health worker says, I believe that I've seen climate change, I've been in this community for many years, I've seen it change, I believe it's the cause of the changes in disease that I'm seeing, can we rely on that observation? Is it good enough? Or should it be dismissed and discarded? Because after all, isn't it just an anecdote?
Definitely not. Definitely, it cannot be dismissed. It has to be taken into account. It has to be considered. And if we want to really drive policy change and system-wide transformation, we need to bring together a wide array of evidence. The evidence that is in numerical form, how many people do have a particular condition, for instance, but also, again, the stories of coping and adaptation and survival, but also the challenges that people are confronting in the front lines. Those are also important inputs to advocacy, to, policy reform, to, systemic change. And so I guess, we really need to build coalitions between scientists and frontline communities to be able to gather this combination of evidence and stories that are necessary for system-wide change. And to the health workers who are in this conversation, who are listening to this session, again, do not underestimate your power. And because you witness it, you encounter it, you face it, you're fighting in the climate front lines. We scientists, we rely on, the stories and the numbers that are coming from the community. But you yourselves are in the front lines dealing with the problems firsthand. And so there is an authentic and, strong power, in your position, in your live experience. And I think I would like to encourage you, to enhance your skills in communication, in presenting the stories and the evidence, in, trying to address and understand the technical aspects, but communicating these technical issues in a way that communities and decision makers can understand. And so, let's continue building our capacity, equipping ourselves, and do not lose hope. I guess I'll stop there for now. Thanks.
Thanks, Renzo. One last question for you. And originally Charlotte was going to ask one, but I'm just looking at the questions we had in mind. And we've mapped out that the dynamic from Teach to Reach, currently at 21,000 plus people connecting to each other, learning from each other, could spark within 5 years a movement of over 1 million health professionals connected to each other, learning from each other's successes, lessons learned, and challenges, and each taking action with their local communities to tackle these impacts. Does that sound too good to be true? And who do you think should be investing in making this happen?
Well, again, I would like to laud your initiative. There's power in numbers. And I hope that, when I saw the numbers a while ago, I hope that next year and in the coming years, we'll keep on increasing our number until we have a global cadre of health workers who are, brave and bold and empowered and equipped and, ready to change the world. And I hope that, the big funders will, put the resources, not only in, global organizations and national level agencies, but ultimately in frontline communities. We always talk about the role of communities, why they are important in building resilience to climate change and protecting our communities from its health effects. But the money, the resources are not with the frontline community health workers. And so, I'm with you in calling our, funders and decision makers to make sure that the resources go to the front lines, because that is where change will begin.
Renzo Guinto for Teach to Reach 10. Get ready if you haven't requested your Teach to Reach invitation. You can do that on the Geneva Learning Foundation's website. Teach to Reach 10. Request your invitation. You can see all you need to do is put in your name, your email. It's of course free if you're a health worker working in a country. 12 days, 22 hours, 43 minutes, 19 seconds as we close our conversation with Renzo Guinto. But as you know, there are many other lightning chats coming up. In fact, this afternoon we'll be speaking with Ravati Falki, who was at the World Health Assembly last week when the climate and health resolution was adopted. We'll be speaking next week with Maria Nera from the World Health Organization, Kate O'Brien, to explore the connection between climate change and immunization. David Akpan, a valued partner for Teach to Reach from eHealth Africa and EHA Clinics, and then our very own first fellow of climate change and health. We'll be talking to him about climate change and decolonization of global health. Once again, thank you for joining us, and we look forward to seeing you at Teach to Reach 10. This is 20th and 21st of June 2024. Health workers will be sharing experience on the front lines, from the front lines of climate change. Take care.